Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon, and today I'm joined by Erik Osland. Erik is the CEO and founder of evolvedMD, a healthcare company revolutionizing the behavioral health industry. With a background as a corporate leader turned serial entrepreneur, Erik has led multiple successful ventures, including a clinical lab that was acquired by a major diagnostic laboratory in 2020. At evolvedMD, he is dedicated to creating integrated, comprehensive, and collaborative behavioral health solutions that prioritize superior patient outcomes. We're excited to have Erik with us today to discuss the inspiration behind evolvedMD, focusing on how the integrated care model within primary care settings is transforming the behavioral health system by making mental health services more accessible, collaborative, and effective for patients with both simple and complex conditions. Well, Erik, thank you so much for coming to the show. Welcome.
Welcome right back at you. It's wonderful to be on the show and excited for the conversation.
Absolutely. So let's just jump right in. Can you share what inspired you to create evolvedMD, especially in response to your father's experience with traditional healthcare?
Yeah, so a little bit of background on me, and that might help kind of feed into the impetus for starting evolvedMD. But I've spent my entire career in healthcare post undergrad, and I would say the first half of my professional life, I was on the physical side of healthcare. So working with health systems, primary care groups, specialists, predominantly focused on the physical health side of treating patients. And ultimately left corporate America. I founded an anatomical pathology lab. And in the midst of running that business, I had an experience that many folks have as they start to care for their aging parents, which is I had a father who was chronically ill. And my dad at the time was shuffling, and my mother, my sister, and I were spending a lot of time shuffling my dad in between his oncologist, his pulmonologist, his cardiologist, his primary care physician, as well as a number of other folks. And at the time, my dad was on 17 medications and he slept 18 hours a day. And we were really grappling with this idea is, his dad, we knew dad was a sick guy. We knew that he was on a lot of medications, but we also knew that my dad was suffering from depression. He was mourning the loss of his functionality and all of the challenges that exist within the chronic care space. And so during that period of time, it ultimately lasted about 8 years before my dad passed away. We were really pushing within his primary care physician group to get access to mental health services. And for a period of about 4 years, we tried pretty deliberately. He was a Medicare beneficiary. And we really had very, very little success, actually no success in getting my dad mental health resources at the time. And so I was really frustrated. My mother was really frustrated. And, out of that frustration came the company that we started, evolvedMD, with this idea that we could integrate behavioral health services inside of a care setting that patients trusted, which was their primary care provider. So 2017, we launched our first site here in the West Valley of Phoenix. And my co-founder, Steve Bilgen, our original clinician, Sarah Hanchu, who's now our chief clinical officer, we sat at that clinic for a full year. We delivered one of the first fully integrated collaborative care programs in the state of Arizona. And we learned a lot about integration, about clinical workflows, about outcomes. And obviously since then we've grown quite a bit and are quite pleased with it. But this originating story all comes down to my father, the experience that we had, and really looking at this through the lens of a loved one or a caregiver, and how do we get the folks that we care about the services when they need them.
Absolutely. And I mentioned right before we got started on the show that I am a social worker in a dialysis clinic. And so I frequently see that struggle that not just the patients, but the patient's family endure in trying to connect them to not just the physical health things that they need to see, but also working through, like you mentioned, that level of grief almost that they experience and having to accept my life is no longer what it has been, and accepting what it looks like going forward. It is definitely a tough transition for most of the patients that I work with.
Yeah, and Sharlee, I mean, it was cool to have that conversation with you prior, and you get to see this every day. But I mean, think about these chronically ill patients that are really going through a challenging course of treatment. For those patients that you see day in and day out, what is the main driver for the patients that you manage when they don't show up for dialysis treatment or they terminate care? I mean, what is the underlying reason for that? It's largely they are giving up, they are depressed.
Mm-hmm. Yep.
And so yes, by treating these things alongside each other, we can improve outcomes not only from a behavioral health perspective and a mental health perspective, but we can improve the outcomes from a physical health perspective as well.
Absolutely. A lot of that, I know, I'm sure you've heard about the social determinants of health. And
Yep.
so if you aren't able to really address, the basic Maslow's hierarchy of needs, then patients are not able to even worry about the health stuff, because what about life? The things that happen in daily life. How will I eat? How will I get transportation to these medical appointments? All of the things that go along with it. It's a complex issue for sure.
Yeah, I mean, this notion of caring for the whole patient, right? There's a lot of
Absolutely.
elements. There's the body, there's the mind, and then there's these other
Mhm.
things that are surrounding our patients every day that are, mitigating their ability to receive care and to care for themselves. So we've got to think more holistically about patients.
Absolutely. So I was really interested to hear about Evolved MD and how you guys work. So can you talk to us a bit more about this integrated care model and how they address the challenges that we've just discussed?
Yeah, I mean, so fundamentally, I think most folks will agree that today we have a very fragmented health system. We have a physical health system that most of us interact with, and then we have a separate behavioral health system. These two systems historically have not talked to one another. They have not created good processes for coordinating care back and forth. And as a result, no one within the system today is largely thinking about how to treat the entire patient, the body and the mind. And so, where does integration come in, and where does evolvedMD come in? We believe that the best care that can be delivered in primary care focuses on the whole patient, so treating both sides of that. We believe that we can knock down many of the barriers and restrictions that exist in accessing behavioral health services by taking behavioral health and putting them into a care setting that patients already trust, which is the primary care setting. And we also recognize the fact that, look, integration can be complex. It can be difficult to structure. It can be difficult to create a financial mechanism that will sustain the program. And so evolvedMD, that is all we do. We are a behavioral health services organization that focuses on one thing, which is placing behavioral health resources directly on site within primary care practices. So today we operate in 5 states, just over 220 individual primary care locations that are fully integrated with our staff on site. And together, alongside their primary care physician, we are treating the whole patient today. We allow the primary care physicians to focus on physical health, and when there is a behavioral health need, whether it's something as mild as mild depression, anxiety, or something as significant as a patient in crisis, we are able to step in, meet that need right there in that care setting within a very short period of time. So, fundamentally, what are we? We are a behavioral health integrator. This is what we do each and every day, and we're really excited about the work that we do.
Awesome. Awesome. So can you talk to us a bit about what that looks like in practice? So you mentioned that a primary care provider can just reach out and do a referral, but what does that really look like? What is that process? Is it, a short time frame? So while I'm sitting with my primary care physician, I mentioned that I'm struggling with something, mental health wise. Are they able to just call and make their referral and we talk then? Or, what does that look like?
Yeah, so I think one, maybe we define what the standard system looks like today, and then we'll talk a little bit about what it looks like in an evolved MD model. And so
Perfect.
so today, about 30 to 40% of patients that go into a primary care office have some level of underlying behavioral health need. In today's system, if the primary care provider does screen for a behavioral health disorder, does have a conversation with the patient, what they'll typically do is they'll say, "Hey, Mrs. Jones, I think it'd be valuable for you to go see a psychiatrist or a therapist. Here's a
Mhm.
list of providers. Please reach out and make a call." What we know is that process today does not work. Less than 20% of patients that are referred from primary care into specialty behavioral health ultimately receive services, which leaves the vast majority of patients really with nowhere to go. And so at evolvedMD, what we will do is we will work alongside existing primary care groups. We'll work with their teams to understand what their behavioral health needs are of their population. From there, we will design an integrated program. And then from there, evolvedMD goes to work. We are their de facto outsourced behavioral health entity. So we will design a program that meets their needs. We will then go out and identify the workforce. So we will hire them, we will train them, and we will employ them at evolvedMD. And then our clinicians actually sit on site within the primary care setting. And so
Oh, wow.
our team looks and feels like a member of that practice. So an example of that in our backyard here, our first large integrated system is a group based here in Scottsdale called Honor Health. They have 27 primary care locations spread across Metro Phoenix. If you go to an Honor Health primary care group today and you have a mental health issue, that primary care provider can simply walk you down the hall. They can introduce you to an evolvedMD behavioral health manager, and we can pick up care immediately if we have availability. And so what does it look like for the patient? It looks like a seamless process. Our employees look and feel like a member of that team. They're operating in their practice alongside the primary care providers. They are operating in the same scheduling system, the same EHR. It is a seamless solution that is really designed to focus on the needs and the experience of the patient.
Wow, that sounds like an awesome experience, not just for the clinician, because, I'm not having to go out and find people to assist, to help. I don't have to do any of that part. But then for the patient as well, because it is, like you mentioned, it is a seamless process and you are able to just see someone in the same office. And yeah, I feel like it would probably even lessen some of the stigma associated with seeking out mental health services as well.
Yeah, I mean, Sharlee, you've been in this space as long as I have, and 5 years
Mhm.
ago we talked about stigma much differently. We've done a
Yep.
lot of work, and we've removed a lot of barriers, but stigma is still a significant issue in certain populations. And so yeah, I think a big part of what we are trying to do is to one, make it easy for patients to access services when they need to, but also do it in a way where we can remove some of those stigmatic barriers that might exist within a community. And the best way to do that is to normalize it in a care setting that they are already being treated in, and really just make this part of the whole process, right?
Right.
Why have we treated physical health in a silo for so long? Let's treat both of these things together.
Absolutely. Because they definitely do play off of each other. Absolutely.
Exactly.
Yep. So is there a certain level of communication then between the mental health provider and the healthcare provider, especially since they're in the same building together?
Yeah, so fundamental to what we are trying to do is to create good communications across both sides of the aisle. And so one, I'll define the model. So at evolvedMD, we deliver a very specific clinical integration model called psychiatric collaborative care, and that's a mouthful. So you'll hear a lot of folks refer to it as COCM. And so COCM is a defined model. There are four elements that are required in order to deliver care. The three of those elements are clinical team members. So you have a primary care provider who is the managing provider for the program. They also act as the billing provider for services rendered, which we'll talk about in a bit, because it's another area that we really are looking to address. But you have a primary care provider. You then have what's called a behavioral health manager. In our world, that's a licensed master's level clinician. They typically all are licensed as well. They are the quarterback for the program. They're engaging the patients directly at the primary care physician's office. They're doing comprehensive assessments, care planning. They're providing short, brief interventions. And they're also aggregating all of this information within a shared EHR so that they can share it across the spectrum. The last member of the team is what's called a psychiatric consultant. The psych consultant doesn't typically see patients face to face. Their job in this model is really on a weekly basis. They meet one-on-one with the care team. They review diagnoses, they review patient care plans. They will work directly with the behavioral health managers on patients that maybe aren't progressing and need more support. And then finally, they'll also provide recommendations around medications, if it's applicable, that can be sent to the PCP for prescribing and management. And so really looking at collaborative care, it is a team-based approach with three clinicians. There is a technology element that's tied to a behavioral health registry so that we can track patient performance over time and ultimately deliver what's called measurement-based care. But all of these things are happening within that primary care ecosystem. And from a communication perspective, not only are we documenting all this information in the same practice EHR, but we're sitting in team huddles on a daily basis. We're having hallway consults. We are a core member of the team, and we're working directly alongside the PCP to manage that patient's whole health.
We'll be right back after a word from our sponsor.
Nearly 9 in 10 registered voters believe the nation faces a mental health crisis, according to a new USA Today Suffolk University poll. Americans are more concerned than ever about their mental health. Mental health first aid provides the resources and training to identify, understand, and respond to signs of mental health and substance use challenges. It provides the confidence and skills needed to offer life-saving assistance, and it provides peace of mind. Our experts provide mental health first aid training for adults, teens, caregivers, veterans, law enforcement, EMS, and school faculty. Mental health concerns are on the rise, but evidence-based training through mental health first aid can make a difference. Visit mentalhealthfirstaid.org to find a course near you, or email hello@mentalhealthfirstaid.org to schedule a training. Courses are available for individuals, groups, organizations, and companies of all sizes. Visit mentalhealthfirstaid.org and make a difference in your community.
That is, I mean, it sounds amazing. Like I mentioned, as a dialysis social worker, I am a part of a similar type of team. We meet interdisciplinary teams with our patients at least once a month. And it really does help to address all of the needs of the patients. And I have found, that the patients really appreciate having me as a social worker, licensed master clinician, being able to say, hey, you know what, things are happening. Let's chat for a little while about this. But then also being able to say to the doctor, these things are happening. Maybe you want to talk to them about medication. So being able to have that not just in a long-term setting with dialysis, having that in a primary care facility is really impressive. I'm almost speechless about this. That's really cool.
Thank you. Thank you.
Yeah.
Yeah, it's when we talk about it in this way, it seems so sensical, right? And I
Yeah.
think the question is why have we not been doing this
Mm.
the entire time? But look, we've got a lot of work to do. There's some great folks out in the market that are doing this work alongside of us, and look, we just need to continue to push on it. This is the future of behavioral health, and it's bringing physical and behavioral health together in one care setting.
Absolutely. Absolutely. A few minutes ago, you mentioned billing. And so then I am also curious about that. So one of the barriers to mental health care is the lack of insurance care that goes along with it, maybe even finding the specific provider that accepts the insurance that you have. How does evolvedMD work around those challenges or even, work to assist them?
Yeah, so this is one of the core design elements of collaborative care, and this approach to integration is that, although evolvedMD and our customers are providing integrated behavioral health services, we actually operate under 3 CPT codes that are specifically designed for COCM. And although these services are, call it, psychiatric in nature, the CPT codes actually reside on the physical health fee schedule. And they are designed to be billed by that patient's primary care or managing provider, which means that for a patient that's going into primary care, many times the cost to access integrated services is the same expense as they would pay to see their PCP from a copay or deductible perspective. We aren't charging a specialty copay, and so everything is really being managed within that ecosystem. And so, fundamentally, one that allows us to knock down some of those barriers related to expense. And then, there are all these other barriers around different types of insurance companies covering different types of services. The great news with collaborative care is that, today we have universal coverage of this service line from most payers from a national perspective. So Medicare and Medicare Advantage cover the service line in primary care. Commercial plans today, I'd say 98% of them cover collaborative care in the primary care setting. And from a Medicaid perspective, it is very much state dependent. We are seeing good progress on that front. Today, 30 states have Medicaid plans that cover collaborative care, and there are new states coming on every year. And so, if you look at the way that we support our customers and the patients that they support along the way, when we walk into a clinic, our goal is to service all of the patients that they service, which means that if they're on panel with that PCP, we can then render services through the insurance mechanism. So, again, a number of advantages, both clinically and economically for the system by operating this way. And again, the goal here is to knock down all the barriers that we currently put in front of patients when it comes to accessing mental health.
Nice, nice. Okay. So in your model, and I don't recall if we discussed this, but patients, how often are they having sessions with their clinicians? Is it like a once a month type check-in? And how does that differ when there is a patient who has a more complex or severe condition, like I mentioned, dialysis or cancer or, some form of addiction?
Yeah, so one, I think it is clear. It's important that we talk about the distinction between collaborative care and traditional therapy.
Mhm.
And along the way, we also have to recognize that the existing model of care within behavioral health doesn't necessarily meet the needs of all patients. Obviously, from an access perspective, we talk about that a lot. But if you start to look at the prevalence that exists within behavioral health and the workforce that we have to support that prevalence, it's not pragmatic for us to think that we can simply offer every single patient weekly therapy that's ongoing. So one, we have to start to shift that paradigm. To me, the biggest shift that has to happen and is underway, specifically in integration, is a move towards what's called measurement-based care. We can no longer treat patients based solely off of qualitative data. We have to start to measure certain metrics along the way. We need to understand which patients are progressing, which patients need more. And so one fundamental to our model and to most integrated models is that we are inherently designed to treat patients towards a designated target. So we will identify a desired outcome. Our job is then to treat that patient to that desired outcome. And when they're there, we will celebrate the patient, we will graduate them off the panel, and we will move on to a new patient to begin to render services. So fundamental to everything that we do and to where the market is shifting is we have to start to have this approach where there is an off-ramp for every single patient that enters the mental health system. And that off-ramp is an outcome, and then graduate them back to their lives where they can deploy those skills. Now, beyond that, going back to our model and how we deliver care, integration approaches vary. Collaborative care in itself is a very distinct model, but even folks within the collaborative care space will deliver care in slightly different ways. At evolvedMD, we believe our job is to act as the front door to mental health services within the primary care setting, which means that we work with practices to train their primary care providers on how to identify, how to talk to patients about mental health, and how to hand them off to evolvedMD. We will take all patients, pediatric to geriatric. We will take all payers, Medicare, Medicaid, commercial, and self-pay. We will take all disorders across the behavioral spectrum and all acuity levels. And from there, what our job is to do is to figure out what that patient needs, whether we can manage that need in primary care, or whether we need to work with that patient to transition care to a specialty outpatient provider. And so today within evolvedMD, we can manage about 80 to 85% of the patients that come to us in primary care where we are their sole provider. And for the other 15 to 20%, we really leverage a care coordination team to identify what resources they need in the community. Maybe they need to go to a substance abuse provider. We then need to find a provider that lives in there or is located in their community that accepts their insurance. And then most importantly, we've got to have a place that can actually accept the patient. They have the ability and the capacity to take them on. And so one, when we look at integration, we really look at this holistically. We need to be the first stop to all patients in their mental health journey. And then from there, manage a big chunk of them in primary care. And for those that need more, we send them out. But the other aspect of a good integration model is the ability to flex and manage high acuity patient needs. And you call that a couple of them, say one, a patient with cancer, another patient that's potentially in crisis. So one, we believe at Evolve that the best behavioral health care is delivered in person with the ability to flex to a virtual solution when that's appropriate for a patient or a particular care setting, say a rural market. But the reason that in-person on-site care through an integration model is so important is that today we have a high percentage of patients that are going to their primary care in active crisis. These are patients with suicidal ideation or in some cases suicidal intent. And these are the types of patients that when they show up in a primary care office, they are going to create a whole lot of disruption for that practice and that physician if there is not a behavioral health resource on site. And so in those instances, these things happen every week in our clinics. Our clinicians, when a patient is identified in crisis, we will step in. We will assess that patient for ideation or intent. We will de-escalate that patient. We'll create a safety plan. And if we feel that the patient can be safely discharged back to their family and then to another care setting, we will let them go and we will start to coordinate services as a follow-up. If the patient has active intent or is more severe, we will work with crisis services to make sure that that patient gets to their next level of care. And hopefully that next level of care is not the emergency department. That is not where we want to send our patients. And so within the collaborative care model, one of the big advantages of us being on site is that we can step in, we can manage those processes. And for any primary care providers that are out there listening, we all know these things are happening at higher and higher frequencies. Now, the other side of the spectrum is patients with really complex physical health conditions. So, we talked a little bit about patients with end-stage renal disease. We have a number of patients that are managing a cancer diagnosis. I can tell you as a father of two young kids, I had When my daughter was 5, we went through a very dramatic couple of years where we had a cancer diagnosis with my 5-year-old. So I
Uh-huh.
know all of the things that come up when you encounter these things. And
Mm-hmm.
in those situations for chronic complex disease sets, we can actually be a great place for those patients to land because we can provide them the tools and resources to manage their physical and their mental health. We can talk through all of the things that are going on in their lives, and we can do it at a frequency that is going to meet their schedule. And so one, going back to kind of how we do that, are we seeing patients on a weekly basis? No. We will typically in our model see a patient once a month for a long form session, which is typically 45 to an hour long. And then subsequent to that, if the patient needs additional touch points during the calendar month, we will typically do 1 to 2 additional outreach calls. So think about going to your therapist, you sit down, we've identified a number of skills that we're going to work on. And then the therapist says, all right, patient, let's go out and let's work on those skills at home. A week or two later, the therapist will pick up the call. They'll say, Sharlee, I'm just checking in to see how you're doing. We talked about some homework and some skills that you were working on. How is that going? How are you feeling? This
Mm-hmm.
also allows us to get a sense of where the patient is at. Maybe we've got to pull them back in because they've had, some sort of exacerbation, but really taking a dual approach with in-person visits that are long form and then short encounters that happen after that during the calendar month to support those patients' needs. So fundamental that's going to differ from a collaborative care model to collaborative care model, but at evolvedMD, we really break up between longer form sessions and then short, brief interactions.
Gotcha. And so let's just say I own a practice and I want to integrate behavioral health services, along with what I provide, with physically. What does that partnership process with evolvedMD look like? And how do you ensure a smooth collaboration?
Yeah. So one, if you're a primary care group out there listening, I would really encourage you to go out and explore integration, whether you're going to use a group like evolvedMD or whether you're going to do this on your own. I think it's a really important feature. It's going to be key to the future of primary care. It's going to be the key to the future of any value-based care relationships. And it's just a better way to manage and support your patient population. For those groups that work alongside evolvedMD, they come to us. We work alongside them to be their de facto outsourced behavioral health group, which means that on the front end, we sit down with their clinical team and we say, here are the core services that we offer. Here's how we approach things. Here are some specific disease sets. Maybe it's pain management. Maybe it's diabetes. Maybe it's, you name it, cancer care, or we can do plugins. Once our customer has told us how they want the model to look, we will then go out and start to build out the models of the program. So first we'll identify workforce in that community. We'll go out and interview, we'll hire, and then we train. We bring everybody back to Scottsdale to train them in-house at evolvedMD. And then from there, we launch the program at their practice, which means that we train all of their staff, everybody from the front desk to the MAs to the individual providers. We provide all the technology elements, all of the billing support, all of the documentation support. And then once the program is launched, we continue to stay there on site. It's our staff member, our W-2 employee that's working on site. We have clinical management support that comes in on a weekly basis to do everything from managing RFT that's on site to helping support workflows, ongoing education and training. We are alongside our customers for the entire journey. And I think one of the things that we're the most proud at evolvedMD is we've been operating now for 8 years. And over that time, we have churned out less than 0.5% of our customer base. Typically, once we sign a customer, we are along that ride for the long term. And so, we have customers here in Phoenix that have been with us for, over 7 years now. And as we continue to expand into new markets like Colorado, Utah, New Mexico, and Florida, we are seeing that our relationship with our customers continues to be consistent and very tight. So this is a very tightly aligned relationship that we have with our customers.
Love that. Because I do think that it starts with the relationship of the providers, and that does kind of trickle down to the patients. You feel that connection level when it starts from the top.
Yeah. We are caring for patients right alongside the primary care team. And for the patients, we don't want them to know that there's a delineation. So we have to be very closely synced.
Very nice. Very nice. So you've mentioned a few times that this type of care is the future. So what are the long-term goals for evolvedMD and, in terms of expanding integrated behavioral healthcare services, and how do you see this model impacting the healthcare system as a whole?
Yeah, so I'll start with the health system as a whole. I think if you look at what we have today, both with prevalence rates for behavioral health and access to care, I think most folks in our space will acknowledge that the current system's not working. 70% of patients that want care or need care don't receive it. And so fundamentally, there has to be a shift underway. And so we believe that the biggest and most significant shift that will occur will be the bringing together of physical and mental health. It's happening today, and it's happening
Yeah.
at a level that we've never seen. And the impact, if we do this successfully, is significant. One, we would expect better outcomes from a behavioral health perspective. We'd also expect better physical health outcomes, especially when you think about conditions like diabetes, hypertension, pain management. We also expect these models to improve overall patient satisfaction with the system. We expect this model to reduce provider burnout. We are a relief valve for these PCPs. And then, the cherry on top of the cake is that if we do these things right, the data is clear. We're also going to significantly reduce the total cost of care to manage patients. So this is the path forward. This is one of the most significant moves that we can make from a behavioral health perspective. And certainly I'm pleased that evolvedMD is on the front end of that. Now, what do I see for evolvedMD? There's a lot of growth ahead for us. Today, we're operating in 5 states. We've got just over 220 clinics that are fully integrated with evolvedMD staff. And I would say, look, we are going to grow in a couple of different ways. One, within our core markets, we will continue to focus on density. Density has power for us and our partners and the way that we engage and we build a network in the community. Example of that is our home state of Arizona. We now have 40% of the primary care practices and clinicians in the state of Arizona under contract to integrate behavioral health services. So one, we will continue to do the work and go deeper in the communities we currently serve. And then we will identify new markets and new states that we will enter. Last year, we entered Florida, which was our only new market last year. This year, we are entering 2 new markets, and we'll continue to tack on new states as we have the capacity to grow in a very deliberate fashion. So I'd say outside of new markets and density, the other thing that we are laser focused on today is identifying additional service lines that complement and enhance the program that we currently offer. A good example of that is, we talked a little bit about the types of patients that we can serve in primary care, but we also talked a little bit about our role in navigating patients into the community for additional services. Today, in almost every market we operate, one of the most challenging service lines to gain access to is psychiatric med management services. In some markets, we are waiting 8 to 12 weeks, if not longer, to gain access to a psychiatrist that can prescribe and manage a patient's medication. That wait is too long. We are competing for that capacity alongside the broader market. And so one of the things that we will be working to launch in June of this year is we will expand into the psychiatric bed management space so that when a patient has a need for more advanced psychiatric interventions, we can give them an option to procure those services through evolvedMD as an in-network provider, or we can step in very quickly. We can begin to prescribe typically within 10 business days with the goal of getting a patient stable on a medication. And when they're stable, I'd like to hand them back to primary care where they can continue to receive refills and being managed within an integrated care setting. So really future for evolvedMD is expanding into new states, going dense in those states, and then launching service lines that complement and support the work that we already have underway.
Absolutely. And I'm glad you mentioned that because that is a question that I had when you mentioned med management. I know I've seen my patients wait months to just hear back from a psychiatrist to start seeing them, to start being prescribed the meds. And that wait time in between can be detrimental, to a patient. It's not just their physical health, but their mental health as well. So
yeah, could you imagine if we had to wait 4 months to see a cardiologist? So we've got to solve for this. And look, there is a big opportunity to disrupt the psychiatric market right now, and it requires a bit of redesign. If you think about the flow of patients into psychiatry, typically a patient will see a psychiatrist 10 to 15 times in that first year to get stable on a medication. And then from there, the psychiatrist will typically continue to manage that patient on their panel forever. And as a standard, that's certainly not a bad thing from a patient care perspective, but what it doesn't do is create ongoing capacity and access. And so, with the work that we've done on the integration side, what if we could just focus on getting that patient to a stable state? And when they're there, let's hand them back into a fully integrated care setting where that primary care provider can continue to refill the prescription. And if something bubbles up, we've got a psychiatric consultant in the background that can provide recommendations, or they can push them back. But really trying to create a system where we're not holding a panel indefinitely, we're really focused on providing exceptional care, a stable patient, and then providing ongoing access within that system.
Nice, nice. And just because I'm very curious. So with all of the changes that are proposed and are already happening with our current administration politically, are there changes or are you concerned about anything impacting evolvedMD's work with patients?
You know, gosh, I wish I had a better sense of how to read the tea leaves with the current administration,
That's tough.
but it's tough.
Mm.
You know, what I would say is historically there has been good bipartisan support for expanding access to mental health resources.
Sure.
There's been good bipartisan support in investing in the category. And, you know, when it comes to behavioral health integration specifically, you know, we have the advantage in that, you know, there is expansive data on this model and on not only on its impact to clinical care, but it's on its impact to total cost of care. And so certainly we need to highlight that issue and to make sure it's front and center. But, you know, at the end of the day, if we are going to solve this mental health crisis that we are in right now, integration is a central piece of that solution. And so what do I know what this administration is going to do on the whole? No, we know that they're going to cut Medicaid enrollment significantly. And so that's certainly going to impact some of our population. But, you know, on the whole, I do believe that regardless of Republican or Democrat or administrations, we should have support for continuing to invest in behavioral health and specifically in behavioral health integration. So I hope I'm not wrong, but we really do see this as a central piece of behavioral health going forward.
I agree with you. And I hope that neither of us are wrong about that. So for our listeners who I know will be interested, how can they learn more about your program and where do they reach out for support?
Yeah, so the marketing team has done a great job of being on pretty much every social media platform. So you could certainly find evolvedMD on Instagram, TikTok, Facebook, all of the platforms that I'm not on personally. You can also find me and connect on LinkedIn, where I share a lot of my material. And then certainly the most direct path is you can visit our website, www.evolvedMD.com, which we'll put in the show notes. You can email me directly at Erik, E-R-I-K, @evolvedMD.com, and we'll make sure that we reach out and we coordinate some interaction with you all. But certainly would encourage everybody to get curious about this category. If we can be of assistance, we'd love to help. And certainly we are big cheerleaders for this movement, and we're just excited to be part of it.
Awesome. And Erik, I really have appreciated speaking with you today. Thank you so much for coming.
Yeah, right back at you, Sharlee. I'm excited to learn more about the work that you all are doing in dialysis.
Absolutely. And thank you to our listeners for taking the time to join us. Make sure to follow us on all our social media at Instagram, TikTok, LinkedIn, and even on YouTube at Behavioral Health Today. And if you like our show, give us 5 stars and leave us a review. That helps our show get discovered and share the valuable insights in each episode. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.